Succinylcholine, aka Sux, is one of our paralytic options that we may have access to pre-hospitally. It is our only depolarizing agent, which means that when we give it, it will cause skeletal muscle depolarization and it will cause fasciculations or like shimmies in our patient briefly after administration. It is a short-acting paralytic, so it takes about 2 minutes in some patients to reach full effect, but it will last only less than 10 minutes, so usually about 6 minutes or so. Like any of our other paralytics, it does not have any sedative or analgesic properties whatsoever. And this is incredibly important to remember because when we are paralyzing someone, we must be aggressive with our analgesia and sedation with that, because otherwise we have a patient who is conscious and paralyzed, and that's one of the worst things that we can do to a patient. Common dosing for Sux is usually about 1.5 mg per kg. I believe your pharma manual says 1 to 2 mg per kg. The reason that this is not so commonly used paralytics pre-hospitally is because it has a lot of contraindications and side effects. Most commonly, it is high risk for causing hyperkalemia, and especially in patients who already have risk factors for that. So patients that have burns, not necessarily acute burns, but ones that are in later stages, patients that are already predisposed to hyperkalemia, patients with neuromuscular disorders, they are not good candidates for this drug versus things like rocuronium, which really have none of those contraindications. This drug also has the ability to cause malignant hyperthermia, which a patient needs to have a genetic predisposition for that to happen to when given this drug. We may very well have no idea that that's going to happen, but if we were to see a rise in end tidal, a rise in temperature, a rise in heart rate after administration, it is a potentially lethal side effect that requires an antidote that we don't have pre-hospitally. So those are just some of the complicating factors, but it is a good short-term paralytic if it is something that you carry. Just make sure that during that time frame you're being aggressive with sedation and analgesia.